Right, well, as you know, I'm Vic Foulkes, and tonight I am joined by a fantastic nurse who's had an amazing career, and who I have the absolute pleasure of working with, and can hear her laugh echoing through the practice on many an occasion, and she totally brightens my day. Lots and lots and lots of days. So can I welcome the fantabulous Simi?
Thank you, Vicky.
Thank you for doing this. Thank you for agreeing to do it. And thank you for coming along tonight, because we're always busy, aren't we, in work? So it's one of those things we
are
in our own time. So would you mind, because you'll do it much better than me, just telling us a little bit about yourself, about your career, and what you've done and where you're up to so far?
Yes, so my name's Simi. I started my career in 1987. So I was literally just 16 years old and left home, and I moved out on the Saturday and the Sunday, and I started work on the Monday. And I remember that day with vivid positivity. It's never left me. And from finishing on that Monday, I just knew that veterinary nursing was the career that I wanted to go down. On the Sunday, I had no idea what to expect. And on the Monday night, honestly, I could have just popped. So excited, thrilled by everything that we did and everything that we saw. So the majority of my career has been in first opinion. I think I've done about 30 years, let's say, roughly, in first opinion. Worked with a diverse amount of different vets, very progressive vets that are now, holding fellowships for the RCVS, they're clinical directors. So I've always had like a progressive bunch of people around me, and I've always been one of those people that's always wanted to learn as much as I can. I qualified in 1993, and I went on to study for my diplomas in advanced surgery and medicine, which I did in 2002 and 2005. And kind of did the normal, work my way up the ranks like you do. So you get your own little branch, and then you progress from that, and you go to head nurse, and then you start to take on more management roles, the normal progression, really. And so I've done quite a varied amount of stuff, looked after all the newbies, clinical coaching, health and safety, quality improvement, all of that kind of thing. And then lockdown, things changed. And I left first opinion and found myself needing to go down a different direction. And I managed to go into referral nursing, which was a complete new sector for me. No idea what went on, no idea the level of work and experience and knowledge that was out there in that. And I think I've always been like a very bubble kind of person. So I've never been bothered with the competition down the road, just concentrated on what's gone on in my practice, if you like. So that was a real eye-opener for me, and I've managed to find my niche there, and I absolutely love cardiology nursing, and my present role is the cardiology nurse with Victoria and supporting me with medicine. So, and I absolutely adore it. I love the cardiology and looking after them all, and even the young ones are so delicate if they are poorly with their hearts. And it's just a little niche that I've found that in some ways I wish I'd found it years ago, but maybe I wouldn't have appreciated it years ago. I think now I've become a little bit older, and nursing is maybe becoming a little bit heavier of a workload for me. I find it a lot more hands off and a lot more gentle nursing, and maybe that's one of the reasons why I've fallen in love with it as well.
Well, it definitely shows that you love it, and obviously they love you, and you do a brilliant job. And can I just say, wow, you know what? That's brilliant. I never knew that you were so young when you started, and that's how it your journey started, and that's amazing. And you should be, and I'm sure you are, but you should be really, really proud of yourself, of what you've done and what you've achieved. I'm going to just say amazing quite a lot through this, I think, because that's what I think you are. So just let me ask again, you qualified in
1993.
1993. Wow.
I know.
That's mind blowing, isn't it? I won't say
Quite a while ago.
Well, so 1993 you qualified, and so in 1993, what route did you take? Because all I remember is that before I did mine, because I was a portfolio nurse, before I did mine, it was the Green Book, and everybody just used to go on about this Green Book. So how did you?
I should have. Well, I've still got my Green Book. I should have got it out. So I'm definitely a Green Book nurse. And we studied. We used to go to night school, and we went to the local college, and they run the nursing course for us. And that was because of the power of the head nurses within the borough, South Yorkshire, which was where we lived. And we went to Rotherham College of Arts and Technology, and we went there at 5 o'clock till 7 every week. And it was the head nurses that taught us. They divided up the syllabus, and they all taught their most passionate section. And they taught us everything we know. The theory went in. Our Jones's Animal Nursing Bibles were there. They're so well thumbed. We got everything from out of that. It was a massive practical session. The dogs were allowed in. They brought their cats in for us to work on. The dental instruments came. Anything that could be brought in from the practices was brought in. And we loved it. We just absolutely loved it. It was such a wild experience. And I think to have those head nurses that were so passionate teaching us everything that they physically knew, do you know what I mean? What they'd learned on the job, I think made a massive difference. And then the little Green Book. Now, I remember it got such a lot of stigma, and it was like, oh, well, they just block sign it, and you don't prove that you've done it. Well, I'm sorry, you need to go back. Those ladies were not signing that book unless you could do it. Yeah. Do you know what I mean? There was no way. And yeah, we did block sign it, because the same as I suppose the clinical coaches now, when you got time with her, she went through that, but she knew what you'd done. Yeah. She knew what you could do. She was on the shop floor with you. Do you know what I mean? Yeah. But yeah, there was no signing if you couldn't do it. So yeah. But I'd still have my Green Book. I should have brought it out.
Oh, and I know a lot of people sort of say when you talk about the Green Book, the people that did do the Green Book, they want it brought back. They thought it was a brilliant way,
absolutely,
to do it, and they'd want it brought back.
Yeah.
Yeah. Oh wow.
Yeah, it was fabulous. Absolutely fabulous. I think as well that I think the difference with it, which I've seen with the students now, is a lot of hours when I see the students now, they go home and they have massive assignments to write, or logging patient, numbers and cross-referencing.
Yeah.
When we went home at night, we all got together and we discussed that case, and we looked into nitrous oxide, we looked into halothane, we studied all those drugs and things. So, and maybe that was a little bit different as well to what these girls have to go through now, and the sheer vast amount of work that they have to do now.
Totally changed, even from when I did mine as well. Yeah, it's totally changed, doesn't it? It's Crazy.
Yeah,
But for the good, I think, you know, for the good.
I think so. I think so.
So, my next question is, what progression have you seen in the profession in the last 20 years?
Yeah, so I think the thing that blows me away more than anything is the treatment options that we have available now. So there's thinking about things, and there's, if you take, like, how do you say it? Is it the FIP treatment, remdesivir,
Yeah,
Palladia,
yeah,
you know, the girls put in the renal bypass systems in surgery, you know.
yeah,
Back in my day, Vic, you know, years ago, if the cats had come in with FIP, or if a dog had been diagnosed with a mast cell tumour
yeah,
or renal injury, you know, those were really sad diagnoses in my day. And those animals got a very short life,
yeah,
or, you know, maybe a major surgery, maybe a leg was amputated to try and stop the spread of that mast cell tumor from the toe, or, you know. And I think now, with, you know, it just goes to show, you know, that the research that's done, and the fact that those animals now do get a chance of treatment, and they can have a longer survival time or a happier
yeah,
life, I think is probably one of the things that I find, you know, most mind blowing, that I can literally say, we couldn't treat that then, but
yeah,
look at us now, we can do that now.
yeah.
You
And you've
know,
been
I
there
think
to
that's
see that
incredible.
change.
Yeah, to
Yeah,
see that change.
yeah,
And then obviously you can't deny the other change for the veterinary nursing profession in itself, with, you know, the register opening in 2007, and again through the hard work of those nurses that came before us fighting for that. So,
yeah,
you know, that was, you know, I think for the veterinary nursing profession, I think that's obviously been the biggest change that we've seen.
yeah, yeah. And then hopefully more to come with the Protect the Title and
Absolutely.
changing
Don't think they
legislation.
sit down, do
No, no, we'll think keep doing it. We'll keep working on that. Um, so where do you see the future of nursing going then?
Yeah, I'm not sure. I know, my little think about things. I'm not sure where it's going. I think the veterinary profession as a whole, I think it would be nice for it to go back, and for it to become a passionate profession again, which has positivity in the public eye. I think years ago, I think the veterinary surgeon and the profession was very admired, and the vet was held in great respect. And I think we've lost that in the public eye to some degree. And I think it would be nice for us to be able to somehow get that respect back, for the workers, you know, that are on the hospital ground, that are still doing things. I do appreciate that we are in a completely changed world, and that changed world has different perspectives and different expectations. For me, I think the foundation of the veterinary profession, though, has never changed throughout the decades and through times. And I think the veterinary surgeons and the veterinary nurses who are going into the profession and who are working now still have the same passion that James Herriot and all those guys had, you
Yeah,
know. And we are just still, you know, the foundation is the same. We are human beings with values and belief that are emotionally invested in animals and their welfare. And I don't think that has ever changed.
yeah,
And I think it would be nice for us to somehow shout that from the rooftops back out to the public, and, you know, to get them to appreciate the hard work that, you know, that we all do, and that we all have to do year in and year out to maintain our qualifications.
Yeah,
I think for the nursing itself, I think obviously we have the registration, we managed to get that, and we've kept on to that, and we're all abiding by the rules of that, working within the Act, within the Code of Conduct, and etc. But I feel we don't probably retain nurses. I feel like sometimes the veterinary nursing qualification is used as a stepping stone to go into a different sector in the veterinary profession and to move on to other things. And I think we need to start looking at longevity to keep girls and boys in the nursing profession. And maybe we should be looking at what can we keep pounding? Can we open up the Act, and can we do more with Schedule 3? Can we start to, we do so much training year on, year out. We have so many additional qualifications. Can we start to produce nurse practitioners, to do minor ailments and illnesses, and to be able to prescribe, to take some of the pressure off our vets? And, maybe that might be, I think, a good direction. And again, for us oldies like me, I'd love to be, I talk all day to the clients and, sorting out their ear disease and their cat's this and their cat's flea allergy, dermatitis and stuff. Do you know what I mean? But maybe we should probably, try and get back, and maybe let's see if we can do more with the registration and try and get some roles that the girls really want to stay in the profession for.
Yeah, definitely. I totally agree. So here's my wild card question now. So and this is why I did, hopefully you can come up with some really good ideas. But what topics do you think that we should be speaking about but aren't?
Yeah, maybe what I've just spoken about. I think I see a real crisis in the veterinary nursing profession where we're not staying within the profession.
Yeah.
I think that's what we need to start talking about. It feels to me like we need to stop talking in some respects. I feel now we've got so much social media exposure. We have so many different conferences, so many different congresses, that when you're trying to find an avenue that you want to go down, it can be quite confusing, because there's so many different platforms out there. And the crux of it is that we're all pretty much talking about the same thing, but we might be just giving it a little bit of a different twist. And I think we need to start, mental health is obviously a massive thing, and me, and it is a massive thing for myself as well at the moment. And I kind of think we've talked about it, we now need to practice what we preach. We have not one more vet. We have civility. We're high on psychological safety for the guys, but I feel even though the companies have their strategies and they have people in place to safeguard us all and make sure we're okay, for me, I feel we need to have a bit more activity on the shop floor, a little bit more day-to-day awareness. Maybe we need to start introducing some governance to make sure that this is okay for the girls, and especially with the girls which, are struggling with the neurodiversities, which none of us had heard of that in our day. You were just a bit weird, do you know what I mean? And we took the mickey out of you, and it was wrong, but we did it. And, that's what we did back then, wasn't it? And we don't do that. We're very tuned into that now. And maybe we should let's stop talking about it now, but let's start getting a little bit more active in that way. And then, as I say, I think probably as well for the profession is to go back to what we said before. We've got to start looking at career paths for longevity. Like I said, the natural progression is to become a team leader, to become the head nurse, to become the manager. I think with corporatisation, those roles are probably being taken up now. They're bringing managers in, business managers in to manage the people, you know, and to manage the finances and the stock controls and that. So I think we need to try and get a little bit more diverse as to how girls can have, you know, a career from training to retirement and keep them retained.
Yeah, that's a really good answer. Yeah, and lots of really good points there. Fabulous. Okay, so here's our last one. You're nearly over, you've nearly done it. And this is one that obviously us as BVNA and as members find really, really important. And
yeah,
the thing that is, you know, that we're working very, very hard at the moment to sort out and to try and get closer to achieving. So what does protect the title mean to you?
Yeah. So I feel that unless you are within the veterinary profession, I don't think anybody understands what that title means. So to try and explain, obviously, I know you, Vicky, and I know you do the teaching, you know, the commitment that the girls that go through their training and the amount of work that they have to do. And we're not talking Monday to Friday, 9 to 5. You know, the girls go home, they're working till 10 a.m., 10 p.m., they're up, they're out, their weekends, overnight. It's vast what those girls have to do. The knowledge and the skills that they have to learn is, again, it's a vast amount of knowledge and skills. To be able to communicate to a client what a vet has spoken to them in medical terms, you know, it's a skill in itself. Without all the practical skills, the biological knowledge, the physiological knowledge, the pharmaceutical knowledge, the medicine knowledge, the surgical knowledge, you know, the infection knowledge, the, you know, it is absolutely huge. I think the emotions that those girls go through, we've all been through it. You know, we've done it ourselves. The tears, the tantrums, the hysterical laughter, which you're not quite sure, is it going to turn into tears or are we going to be all right? No, it's unmeasurable. I honestly don't think people know what they go through, you know, for the training to get that career. You see it when these girls qualify on the shop floor and, you know, they start crying, the nurses around them start cheering, you know, and the older ones, the head nurses, the, you know, the girls like myself that have been in it for a long time do, you know, get a little bit of stingy eye and the little soft nod and they walk away to contain their emotion because they know what they've been through. Do you know what I mean?
Yeah.
So I used to, I just don't think people understand. I also used to do careers night for the BVNA, and I've seen a lot of work experience come through that want to be nurses, etc. And a lot of the school kids used to say to me, oh, you know, I want to be a veterinary nurse, it's going to be great, I can play with animals, whatever. And one of the questions I used to ask them was, would you be a veterinary nurse for free? If you receive no salary, would you still want to do the job? And if they said no, then I'd say, well, then unfortunately, I don't think it would be the career path for yourself. And I'd explain why, I'd explain the amount of work involved, I'd explain the unpaid work involved, the overnight shifts, the overtime, you know, the trauma, the driving home, still thinking about that case, the driving into work, thinking about that case, the
home crying
researching back, trying to, I read, you know,
Yeah.
I read something, what did I read? And I used to go through it with them, and then they'd say to me, oh, you know, why do you bother? And so for me, the reason why I bother, Vic, and it's probably the reason why most of us bother, and for me, this is the reason why we need to protect the title. When you've had any animal, but let's say the dog that's been in the practice, been in the hospital for a week, 2-3 weeks, and you've nursed that animal intensely. You and your team have been up, you've been down, you've argued with your vets about, you know, you've stood there as an advocate for that patient. Are you doing it right? You've argued with them. This isn't fair. Look at it. It's not fair. No, I promise, you know, the vets have got together. They've questioned, should we be carrying on? Am I doing the right thing? They've researched deeper. You've had the conversations with the clients. One minute you're up, the next minute you're down. We've all been there. And then the day comes, I'm going to get emotional now. So the day comes when that dog gets discharged, and you and your team stand on the doorstep of your practice, and you watch that dog walk away, look up at its owner, and its little tail's wagging as it goes back to the hospital, as it goes back to the car to go home.
Yeah.
And for me, that feeling that nobody else can experience is the reason why we need to protect the title, because everything that we've worked for, everything that we do, even down to unpacking the order, is for that moment, and that moment of pride, of achievement, of joy, before we turn round, go in and do it all over again. And that is why, for me, the term registered veterinary nurse has to be protected.
I don't think I can say anything to that. That was brilliant. And yeah, you can see me. I'm when you talk about it, it does. You think about all the patients that you've done that to, and that you didn't think you were going to get there with, and yeah, definitely. That's an amazing answer, Simi. It is amazing. Yeah, absolutely fabulous. Well, now that we've got that lovely warm fuzzy feeling inside, I'm going to say thank you very, very much. Thanks for coming to do that.
That's okay.
Brilliant talking to you, and I know we talk all the time in work, but there's so many things that I've learned, and I've had this brilliant insight into Simi and her crazy little world. Now I know the crazy little world side, but really, yeah, little crazy bubble. Well, that was really interesting and amazing answers, and I'm so glad that I thought of you to do this with.